Early to bed and early to rise makes a man healthy, wealthy and wise. We all have heard this in our childhood. But is it really that easy to be healthy? Probably not. A good health and well-being depends on many factors like your surrounding, food, lifestyle and many more. But all these things are not accessible to every person in the world. So to prevail over from this issue, the third goal of SDG 2030 is good health and well-being, set by UNGA. So what things are targeted under this goal and how India is looking for to achieve this goal? And the most important, what's your role to achieve this goal? Hi, I am Rakshita Shah and you are watching triple.com. From the last 1 year, not only India but the whole world faced huge health crisis due to COVID-19. Millions of people died and billions of people did suffer, and still many people are suffering. Many variants found in different parts of the world, and on daily basis many different diseases are being discovered by doctors and scientists. Among them, many of the diseases are curable, means their vaccinations and treatments or medicines are available. But these treatments and vaccination is not accessible to everyone. Millions of people pulled to the poverty due to the huge expenses spent on the health, and many of the people don't get enough treatment. In many regions, hospitals and doctors are not available. Sometimes patients suffer due to inefficiency of doctors, nurses and staff. Many times treatment are not affordable for the patient or their family. Inefficiency or unavailability of machines, equipments, medicines, poor infrastructure, cleanliness, sanitation, clean water, healthy and nutritious food. All these factors affects the health. Not only does disease impact the well-being of an individual, but it burdens family and public resources, weakens society and squanders potential. The health and well-being of people at all ages therefore lies it at the heart of sustainable development. Protection from disease is not only fundamental to survival, but it enables opportunity for everyone and strengthens economic growth and prosperity. Suicide is the second leading cause of death globally between the ages of 19 to 25. So what are the targets of third goal, good health and well-being? First is a safe and healthy birth for a mother and a child. It ensures that the global maternal mortality ratio reduced to less than 70% on 1 lakh live births. Next is preventable deaths of newborn and children under 5 years of age, with the all countries aiming to reduce neonatal mortality to at least as low as 12 per on 1000 live births, and under 5 mortality at least as low as 20 per 1000 live births. Third is the end the epidemic of AIDS, tuberculosis, malaria and neglected tropical disease, and combat hepatitis, waterborne disease and other communicable diseases. Then reduce by 1/3 premature mortality from non-communicable disease through prevention and treatment, and promote mental health and well-being. Next is strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Halve the number of global deaths and injuries from road traffic accidents. So by 2030, government ensures to construct proper and safe road and infrastructure. Also, we all must ensure to drive properly and safely by following all the rules and regulations. The universal access to the sexual and reproductive health care services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. Achieve universal health coverage, including financial risk protection, access to quality essential health care services, and access to the safe, effective, quality and affordable essential medicines and vaccines for all. Substantially reduce the number of deaths and illness from hazardous chemicals and air, water and soil pollution and contamination. Strengthen the implementation of the World Health Organization Framework Convention on the Tobacco Control in all countries as appropriate. Support research and development and universal access to affordable vaccines and medicines. Substantially increase health financing and the recruitment, development, training and the retention of the health workforce in developing countries, especially in least developed countries and the small islands developing states. Strengthen the capacity of all the countries, in particular developing countries, for early warning, risk reduction and management of national and global health risks. All these are the targets set under SDG's third goal for all the nations. Now, what India is doing to achieve these goals? There are some programs and mission runs by the Indian government. First is National Health Mission, including NRHM. Second is Human Resource in Health and Medical Education. Then the National Mission on Ayush, including Mission on Medical Plants, National AIDS and STD Control Program, and Integrated Child Development Services (ICDS). And in the last, what's your role to achieve the goal? Good health and well-being. First and the most important is make sure your family and friends are vaccinated. There is a huge need to curb the pollution because pollution causes diseases like asthma. In 2018, 1.3 billion people suffered asthma. Keep your surrounding clean. With this, also try to keep the air, water, soil clean and spread awareness regarding these. Run campaigns, or also you can participate in ongoing campaigns. Take a healthy diet and do exercise or yoga, because obesity is also the major problem which causes many diseases, and majorly obesity found in adults in India and also in the world. Consult with doctor if you are suffering from any disease, illness or infection. Take a proper medication. Don't follow WhatsApp forward treatment, or don't believe on rumors about any disease and their treatment. Just always consult with some professional, and the harmful treatment are advices, because your choice is your choice, none of ours, because your health and wealth affects the economy and the whole nation. Thank you.